I'll be talking about patient experience. So I'm going to start my presentation with a short story. So imagine an elderly gentleman walking in a long hallway in a large hospital, and he appears to be walking from the emergency room and down that hallway. I'm standing in the hallway having a conversation with one of my colleagues, and I see him walking slowly, looking up, looking for signs, looking at the people walking back and forth, passing him by. It's like nobody sees him, but he has this look on his face that he's lost, that he's looking for someone. Have you ever had, you know this look when you're looking at people and you're just about to ask for help, but you don't? So at one point, one of the staff members, he stops for a second, he speaks with him, and he does that, and then he continues walking. The gentleman looks back, the face didn't change, same thing. So really nothing added, that the interaction didn't add anything. So I stop my conversation with my colleague, I walk over, I ask him, how can I help? And he says, they sent me off from the ER to go to the lab because I need to get some blood tests done. So I take him by the hand and I walk him to the lab. As we're walking, I tell him, it happens a lot. I've been working in this hospital for 10 years and sometimes I get lost looking for somebody's office, so don't worry about it. So we make it to the lab. I present him to one of my colleagues there, and we sort out his things. And I ask them, please make sure someone escorts this gentleman back to the ER. So obviously I did not help in treating him medically. I just tried to make his experience a little bit better. So being aware of your surroundings is vital. When you are working in any institution, especially when you're working in healthcare, any employee and every staff member should always have an eye out for what's happening around them, how you can help, and how you can improve the experience. We'll get to the experience in a second. So this is a definition of patient experience, okay, as it is set by the Agency for Healthcare Research and Quality in the United States. It's very accurate, but to me it's very academic. It makes sense, but if I want to tell you what the experience is, I just want you to focus on the word that says interactions. This is just the score that is used to calculate experience. You've all seen this question in some form or another, whether or not you would recommend our services, our hospital, our store, our airlines. This is basically the single most question that is asked to assess experience. So, satisfaction or experience. I showed you the definition of experience, but I don't think anybody remembered it. I can't even memorize it, except the point that it is about the interactions. So, satisfaction, اللي هو الرضا, okay? To me, to make it simple, satisfaction is reaching a goal. When you reach your goal, you're satisfied. The experience, on the other hand, is the journey that you took to reach your goal. So you may or you may not reach your goal, but the experience is the emotional factor. We've all been on airplanes and we've all been to hotels. When you finish, at the end of your flight, when you're disembarking your flight, or at the end of your stay at a hotel, what do they ask you? They ask you, did you enjoy your stay with us? Did you enjoy your flight with us? Nobody's going to ask you, were you satisfied with our service? So enjoyment is the experience, it's the emotion behind every interaction that happens. So experience is the journey. So how do we enhance this experience? Obviously, I'm coming from a medical background, but this applies to anything. If you're a customer and requesting or going for any service, it's also about the experience. So this journey is comprised of interactions. interactions, or we'd like to call them touch points. So every single touch point is going to affect your experience or journey, whether it be positive or negative. So we aim to make sure that every single interaction with a patient, if we're talking about healthcare, is a positive one, and it adds to the positive, and it has to be continuous throughout the whole journey. These interactions are non-human and human. So if we're going to talk about non-human interactions, for example, it's going to be obviously anything that's non-human. Like if you're going to the hospital, the first thing you do is probably look up the website. You want to make an appointment. You call the hospital. You go to the hospital. Is it easy to find? Is it on Google Maps? When you get to the hospital, is there parking? The worst thing you can do, and it's unfortunately very common, you can't find parking. You spend half an hour looking for parking and you're not feeling well, you're sick, you have a family member you're taking to the hospital. So you've already started impacting the experience in a negative way, and you have not even reached the building of the hospital. The waiting rooms, are they accommodating? Are they comfortable? Is there air conditioned? Is it tight? Is it crowded? This is all non-human factors that affect your experience. So moving on to the the human factors. Before I move there, I just want to ask, we have to always differentiate between sympathy and empathy. So sympathy doesn't really help. It's feeling sorry for someone, feeling sad for someone. It doesn't really help. Empathy is an integral part of improving an experience. Empathy basically, simply put, is putting yourself in the other person's shoes. So if you are in his position, how would you like to be treated? How would you like to be instructed? What do you need to feel? So it's all about the emotions. The experience itself is critical to make healthcare, it plays an integral role in the person's healthcare. Because we're going to take the fact that treatment and medical care is at the highest standard. And this has its governing bodies, okay? That's not what we're talking about. You can have the best doctors, the best nurses, the best everyone in the hospital, but if they do not treat the patients with dignity, with care, with honesty, with sincerity, I'm just there to do my job. Your job is to make the patient feel cared for. This is what makes the difference. So there are obviously many things. So the patient needs to feel, okay, that's not going. So they need to feel, you have to worry or take care about their feelings, their emotions, and how you can do that with empathy, respect. So I'm just going to go with this slide. It's the same clicker you had before, still not working. All right. In closing, I'm going to show, there is Dr. Fred Lee. This is a gentleman who was working in healthcare, and he worked at Disney to improve the experience at Disney. He wrote a book, an amazing book, titled If Disney Ran Your Hospital. He later moved back into healthcare and trying to implement all the experience, improvement, techniques, and methods in healthcare. It's an amazing book. He had a presentation in TED Maastricht in 2011. It was titled Patient Satisfaction or Patient Experience. It's on YouTube. I recommend everyone to see it, even if you're not in the medical field. So he had a slide at the end of his presentation which read the following: healthcare is in the same sector as Disney, offering a different experience. Disney its job or function is meeting the emotional needs of a family to have fun together. However, hospitals, they're meeting the emotional needs of families going through fear, pain, and even tragedy sometimes. So a hospital without compassion is like Disney without fun. It's just not going to work. Thank you very much.